Our program of excellence is entitled Translational Research in Cancer, and we aim to bring the discoveries into the patients, ultimately to improve the survival of the patients. Our program is composed by 6 groups of research and 2 additional groups that will come with us, and is targeting several diseases, particularly liver cancer, colorectal cancer, pancreatic cancer, gastric cancer, and melanoma. There are 3 translational clinical groups and 3 basic groups. In terms of lines of research, we are focusing on risk factors, predicting occurrence of and development of cancer on one hand. The second, molecular pathogenesis and drivers as targets for therapies. The third will be artificial intelligence to identify a response to therapies. And finally, also other types of biomarkers to identify response and resistance to therapies. Overall, the purpose is to improve the survival of the patient.
The program also aims to implement several technological platforms, and one of them will be related to the inclusion of a registry of tumor samples across the different tumors that are studied within the program. The other one will be related to the implementation of upfront technologies in the area of omics technology, like single-cell RNA sequencing or spatial transcriptomics. Also, other omics will be part of these technological platforms. And then there will be a very key development on artificial intelligence with the implementation of an algorithm based on these aspects. And finally, the development of a platform on experimental models, both on organoids and also on mouse models, to be able to respond altogether to the main objective of the program.